Joining me live from Gombe is the State Commissioner for Health, Dr. Ahmed Mohamed Ghana. Honorable Commissioner, sir, we thank you for joining us. Now, let's talk about the protests by COVID-19 patients in isolation center in Gombe, in your state. Please tell us more about the protest.
Well, it was an unfortunate incident that happened yesterday, that some of the confirmed COVID-19 confirmed cases came out and barricaded the road on the premise that one of the patients there, one of the occupants there, had a very smelly wound, and so they drew our attention, and we promptly went there, in a bid to evacuate that patient to a safer location. But of course, it deteriorated into, a kind of a skirmishes, and which we came to understand that it was kind of an orchestrated and mischievous, attempt by some of the disgruntled people there, for the obvious reason that they simply do not believe that COVID-19 is true, that it truly exists. So it's a very big, serious issue, because despite all the state government effort towards getting the state very prepared and the very massive, social and public enlightenment that we have embarked upon for the last 2 months, there's still a big chunk of our population that do not believe that this disease exists. They think the government is just concocting numbers, that we're just accumulating numbers and ultimately looking forward to get some money from the federal government. This is unfortunate. And I don't think it's going to be a positive thing, in the containment of COVID-19 across the entire operation.
Okay, Commissioner, sir, what is the situation right now?
Well, the situation is quite calm. We were able to evacuate that lady yesterday out of camp, and of course, based on the terms that we must take that lady to back to her base in Billiri. Of course, we agreed, but then, of course, we took her straight to a health facility in Billiri under the custody of the medical officer, and then, of course, the police and the traditional ruler, were all informed, and we're continuing to treat that lady. We'll continue to look at the issues, at the camp, but I think what is becoming very obvious is the fact that COVID-19 is not just a health issue. It is a social issue, a psychological issue, economic issue. It's a multifaceted and multidimensional, problem and crisis that the whole world is facing. And I think we have to evolve, and re-strategize so that we address this, very multifaceted nature of the disease, such a way that we can, come to terms with the issue.
Okay, now, just finally, tell us what other measures have the state government put in place to contain the spread of COVID-19?
Well, the government is very, it has deployed all the arsenals within, our disposal in terms of making sure that all the isolation facilities are ready, and that, health facilities, the workers have been trained, they have been deployed, and they are already functioning. Security, apparatus across the entire state is working assiduously to ensure that, cases that are coming into Gombe State are, kind of checked. If you look at the numbers that we have in Gombe State, which as at the last time was 88 from NCDC, 100% of them were imported cases, mainly from Kano and then to some extent from the Lagos and Kano. And the effort of the state government is actually what has culminated into diagnosing these cases, even before they got into our communities. And so if you look at Gombe State, it's relatively, in terms of, signs and symptoms of COVID-19 within the community, you can hardly find that, because we've been able to pick these people at the earliest point, at the point of entry, and then we've been able to isolate them. And this is, active case search, which many states have not really been doing. And that's why you have such a high number in Gombe State. It's because the state government has been very proactive, because we've been able to check people, the influx of people that are coming into Gombe State, and we're able to isolate them. We're able to go on contact tracing, and that has basically, ensured that our community is still largely free of COVID-19. And you've not that, unlike what's happening, in places like Kano. One of the reasons why the Kano situation has gotten out of control is simply because they were not testing. And despite all the difficulties that we have here in Gombe, we are very far away from any testing laboratory. Every day we have to go between Gombe, 600 kilometers from Abuja, to just take a sample. Even if it is just for sample, we have to go every day, and then get this result back into Gombe. So every day we've been doing this. The state government has been running helter-skelter to get NCDC to come and support us to have, a testing facility in Gombe. This has not really come to fruition. And if you look at Gombe, it has bounds with all the 5 other states in the northeast geopolitical zone. So this is the place to have a laboratory, because people go into all these things. It has to go, and a lot of the work that the state government is shouldering, we're doing that at the instance of the other 5 states. And so this is clearly a justification that the federal government needs to step into Gombe before it becomes a disaster, in the northeast region.
Honorable Commissioner, we thank you. It's good to know that the state is doing a lot to contain the spread of the virus. Thank you for sharing your thoughts with us on Nationwide.
Thank you very much.
Thank you. We had been talking with the Commissioner for Health of Gombe State, Dr.
Environment such as hotels, where they will be comfortably looked after, because they do not require any